This is Dr. Gable with Inspire Smile. So welcome back to week 2 of Myofascial Syndrome Physical Medicine Protocol Exercise Program. I am grateful for you to be choosing me to guide you through the exercises. So in this week 1, we focused on posture, breathing, and correct head position. So those were really important. So make sure you did those. Check in again with your doctor about your progress and making sure that there's nothing else that needs to be taken into consideration. Week 2. So week 2, we will start by the proper head position that we learned in our previous video, where we're basically making like a double chin and standing nice and straight, or sitting. You could do this sitting as well. So that's fine as long as everything is in correct alignment. So head, make like a little bit of a double chin, and then relax into it and stay right there. So that is the correct position for the head and neck, or head over the neck. And the second part of this week 2 training, and we are going to do all of these in real time together. Second is going to be an exercise called N-rest. So N-rest has to do with the proper position of the mouth and the tongue, something that does not create stress on the muscles in the joint. So what that is a position of your tongue. So to be able to get it in the correct position, we want the tongue to be resting along the palate, which is the roof of your mouth, right behind 2 front teeth. So not right at the front teeth. So right, like feel where the gum is behind your 2 front teeth. And then you would put the tip of your tongue right in that position. So that is where tongue should be resting. So at rest, we don't want the teeth to be coming together. So as soon as we bow down, like even try to bow down, that activates the muscles right there. And you can even feel it on yourself. So as soon as teeth come together, it activates muscles. So we're trying to deactivate the muscles, retrain them and stretch them, essentially like a yoga for the mouth. So we don't want the teeth to be touching other than eating, and maybe in speaking, sometimes they kind of touch. That's normal. So normal rest position for the mouth is when teeth do not touch. So again, release this pressure from the muscles, does not place unnecessary strain that's damaging on the joint and the ligaments. It's called also sometimes an Emma position. So that's where your mouth ends up at the end of the word Emma, like an English name. You say Emma, so teeth not touching, muscles relaxed, not clenching, and lips together, but just gently unsealed right in the front, and the tongue is right behind the 2 front upper teeth, touching the gum. And we'll demonstrate that. So end position is this. So without smiling. So when you smile, you do use the muscles, so don't smile. It's also a position that is, if you want to visualize it, it's basically what's used in commercials, on the covers of magazines, like models and things like that. So the reason why it's usually used, like the mouth is just gently unsealed right in the front, because it's considered to be the most youthful, the most relaxed. And the reason why it's considered to be attractive is because the person is relaxed, in a good state emotionally, and just healthy. So that's why it's considered to be attractive. Attractiveness actually is related to a state of health and well-being, and that's why, we like it. So it's used commercially for that purpose. So, but it is also something that's really healthy for you. So end position for the mouth. And also end stretch would be the next one to practice this week. End stretch would be everything that we described at end rest. And then you would place your tongue again. So muscles relaxed, teeth are not touching, tongue right behind your 2 upper front teeth. And then all you would need to do is just use your tongue almost like a spring to open as far as it will allow you to open naturally without straining or pain. And then when you close, you will just not bring your teeth together, because we don't want teeth touching, activates the muscles. So that is just training the muscles that assist in opening to be able to open without strain. And it precludes, again, any additional force on the joint. So just take a moment. If you would like to just go ahead and do the exercises on your own, that's totally fine now that you know. And rest, so your head Nice position. And rest. And stretch. Take a couple of long deep breaths and go ahead and do the exercises. So you would need to do all of the exercises 6 times during the day. So that's about every 2 hours. And you're going to do each exercise for 6 breaths, those Ujjayi breaths that we learned about in week 1. So you need to use that type of breathing, and you're going to repeat each exercise twice. So 2 reps, 6 breaths each, 6 times during the day, and the whole program is 6 weeks. So now, if you would like for me to coach you through that, then go ahead and just continue on with the video. And so we'll get the head in the right position and just do the exercises in real time. That's rep 1 of 6 breaths. That's rep 2. So we just completed end rest, and we're going to go into end stretch. That's rep 1. And that's rep 2. So we completed our week 2 exercises. So actually with end stretch, just you don't have to do it 6 times, it's just with 6 breaths. Okay, so however many reps you can fit into that, but twice. So that's really important. Another really important part of this, it cannot be jerked and it cannot be fast. So actually in yoga, there's something that's called LSD. So maybe it's an easy way for you to remember, of, in general, how to do that. That means longer, slower, and deeper. So focus on LSD.